Many a times these patients are totally asymptomatic. Sometimes in advanced disease they can have pain in the abdomen, sometimes excessive white discharge, and if the disease is so extensive and it spreads to the uterus, sometimes these patients can present to us with less bleeding during periods and irregular cycles. Mostly tubal disease is due to infection. The infection can happen after an abortion, sometimes after delivery. It may be sexually transmitted disease and sometimes even tuberculosis. It need not be always an infective etiology. Sometimes it may be secondary complication due to other disease like endometriosis, which is an inflammatory disease. The inflammation spreads into the tube and it can block the tube and it can damage the tube. It is difficult to diagnose with ultrasound. Unless the tube is totally damaged and distended with the infected fluid, it can be diagnosed with ultrasound. Sometimes if the disease is extensive, involving the uterus, damaging the uterine cavity, the patient may have thin endometrium in ultrasound. Generally, to diagnose tubal disease, primary investigation is HSG, where we inject radiopaque dye into the uterus and take X-ray. So, tubal block can be diagnosed with HSG, sometimes distended infected tube, we call it as hydrosalpinx, can also be diagnosed with HSG. If the disease is extending into the uterus, damaging the inner layers of uterus, it can be suspected with HSG, but it is not 100% accurate. The gold standard diagnostic tool for tubal disease is laparoscopy. In our Guru hospital, our protocol is, in addition to laparoscopy, we do hysteroscopy to rule out extension of tubal disease into the uterus. After diagnosing tubal disease, it doesn't stop there. Sometimes, if it is an extensive disease, it may cause total adhesion in the pelvic cavity and the blood supply to ovary may be compromised, and so the patient may have reduced number of eggs and reduced quality of eggs. Sometimes if it extends into the uterus, it may damage the inner layers of endometrium and cause intrauterine adhesion. It is not only sufficient to diagnose the tubal disease, but we should expect these complications and we should diagnose these complications also to have a good success rate. We all know that only in normal tube fertilization takes place. So, if the tube is damaged, definitely the patient cannot conceive naturally because the egg doesn't come in to contact with the sperm. Fallopian tube is 10 centimeter long and it is attached to the uterus. So, the disease can affect the portion of the tube which is close to the uterus, or sometimes the disease may affect the tube which is far away from the uterine cavity. So, if it is very close to the uterus and only a small segment like 1 centimeter, less than 1 centimeter tube is affected, in our Guru hospital our protocol is to proceed with hysteroscopic surgery to remove the block. We call it as hysteroscopic tubal cannulation. There is no cut in this surgery. The guide wire is passed through the tube under hysteroscope guidance and the block is removed. But the tube which is far away from the uterus is affected, then we plan for laparoscopic surgery, that we call it as laparoscopic fimbrioplasty. Many a times we come across patients coming to us after family planning surgery, wanting a pregnancy after that, maybe because of late decision, or sometimes after remarriage, sometimes after some mishap in the family. Whatever may be the reason, if the patient had undergone family planning surgery and she wants another baby, it is possible with various treatments. One of the treatment is corrective surgery. Whatever may be the reason, if the patient wants to conceive after family planning surgery, it is possible with various modalities. One is re-canalization, that is connecting the tubes, removing the damaged tubes and connecting the normal tubes. Previously, open surgery was the method of choice or only surgery available at that time, but nowadays we go for laparoscopic corrective microsurgery. With the magnification of recent telescopes and also with micro instruments and micro suturing, it is now becoming possible with laparoscopic surgery. We have done a large number of cases of laparoscopic microsurgery for patients with tubal disease or who had undergone family planning surgery. It is really successful, comparable to open surgery, with less complications because of less adhesions. Early diagnosis, proper investigation and appropriate treatment of these patients with tubal disease will have a very good success rate and pregnancy rates.